Hello, another Dr. Toney Rehab. This video is the arch, the thoracic arch. What is the purpose of the thoracic arch and how do we use it? The purpose of the thoracic arch is most people, not all, but most people, and you specifically, if you have this video, you have what's called a hyperkyphosis in the thoracic spine. What the heck does that mean? That means basically that you have too much of a curvature this way in the back. Usually, that's due to the fact that the head is forward. So the head goes forward, shoulders roll in, back goes out. And so you get this effect. It looks pretty bad, doesn't it? You want to be back up here, more neutral. And so the thoracic arch, this specific maneuver is a passive stretch. Again, not active, passive. And what it's doing, it's passively stretching the anterior part of the front part of the spine in the back. So it's the front part of the spine that's in the back. So we're going to lay on this thing and work up to 20 minutes. Most stretching type maneuvers or rehab is 20 minutes at the most. The reason why is because you don't need to go past 20 minutes. It doesn't do it any more benefit by going longer than 20. So up to 20 minutes, you're going to take your time on this. If you notice on the arch, there is a spacer. The spacer is there, so when you use it without the spacer at first, if it's not aggressive enough, put the spacer on. I'm going to show you with the spacer, but you're going to start off without the spacer. If you could tolerate it without the spacer, no big deal. Put the spacer on and do the spacer as well. I'm going to show you how to use it. When you're on this, again, if you experience dizziness, if you experience lightheadedness while you're on it, just get off it and tell me about it. Don't use it again until you tell me. If you go on and it's like, oh, this is killing me, and you can last 3 or 4 minutes, that's okay. Last 3 or 4 minutes. It's fine because you're going to do it again that day and again that day. You're eventually going to work up to 20 minutes at a time laying on this arch. This is an important one as well. Let me show you how it's done so you could see. Put my arch right here. You're going to lay on a firm, you're going to try to find a firm surface to lay on here. You don't want to do this on the bed. It'll just sink in too much. It's not going to do much benefit. So find a firm surface. A carpeted floor, you could even put a pad down on the floor, that's fine. You want your knees up. Some people like it with their legs straight. It's up to you. Most of the time we tell people to put their knees up. If it's bothering your low back and you straighten the legs, sometimes that helps. Whatever you find easier, but this is how you do it. You want to make sure that sits right about the middle, the bra line on most women, or just above the bra line, or between the scapula, between the shoulder blades on most guys. So this is what it should look like when you go on it. You're going to come back down on it. It might move around on you, but eventually you'll figure out how to do it. You lay right about where you should be, adjust yourself, and you're just going to lay there. And if you notice, my chest is pushed forward. This is how it should be. I'm going to get a good stretch of my neck as well. If I need to, I could support my neck a little bit with a pillow, but not much. You want that stretching right here. This is great for the mid-back area. So this is it. You're going to lay here for 20 minutes. It's no big deal. Again, if you experience any symptoms like lightheadedness or dizziness, then get off it. Don't use it again till you tell me. And when you get off it, you can either roll off or just come on off it this way. And that is it. That is the thoracic arch. Pretty easy one. Do it. It's important. And once again, you have a great day.